Viruses. Types of viruses: Ebola, influenza, COVID-19 or coronavirus, E. coli, and pneumonia. Ebola. Ebola virus disease is a rare and deadly disease in people and non-human primates. The virus that causes Ebola are located mainly in sub-Saharan Africa. People can get Ebola through direct contact with an infected animal or a sick or dead person infected with Ebola virus. Symptoms are high fever, headache, joint and muscle aches, sore throat, weakness, stomach pain, lack of appetite. Influenza. Influenza is a viral infection that attacks your respiratory system, your nose, throat, and lungs. Influenza is commonly called the flu, but it's not the same as the stomach flu virus that causes diarrhea and vomiting. For most people, influenza resolves on its own, but sometimes influenza and its complications can be deadly. Symptoms: fever or feeling feverish chills, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue or tiredness, and some people may have vomiting and diarrhea. This is more common in children than adults. COVID-19. Coronavirus disease, or COVID-19, is an infectious disease caused by a new virus. The disease causes respiratory illness like the flu, with symptoms such as cough, fever, and in more severe cases, difficulty breathing. You can protect yourself by washing your hands frequently, avoiding touching your face, and avoiding close contact, 1 meter or 3 feet, with people who are unwell. Symptoms: fever, cough, shortness of breath or difficulty breathing, tiredness, aches, runny nose, sore throat, headache, diarrhea, and vomiting. West Nile virus. West Nile virus is an infectious disease that first appeared in the United States in 1999. Infected mosquitoes spread the virus that causes it. People who get West Nile virus usually have no symptoms or mild symptoms. If West Nile virus enters the brain, however, it can be life-threatening. It may cause inflammation of the brain called encephalitis, or inflammation of the tissue that surrounds the brain and spinal cord, called meningitis. A physical exam, medical history, and laboratory tests can diagnose it. Older people and those with weakened immune systems are at most risk. Symptoms are fever, headache, body aches, vomiting, diarrhea, fatigue, and skin rash. E. coli. Escherichia coli, abbreviated as E. coli, are bacteria found in the environment, foods, and intestines of people and animals. E. coli are a large and diverse group of bacteria. Although most strains of E. coli are harmless, others can make you sick. Some kinds of E. coli can cause diarrhea, while others can cause urinary tract infections, respiratory illness, and pneumonia or other illnesses. Symptoms are nausea, vomiting, stomach cramps or abdominal pain, diarrhea that is often bloody, fever about 100 to 101 Fahrenheit, malaise, loss of appetite, and mild dehydration. Pneumonia. Pneumonia is an infection of the lungs that can cause mild to severe illness in people of all ages. Vaccines can prevent some types of pneumonia. You can also prevent pneumonia and other respiratory infections by following good hygiene practices. These practices include washing your hands regularly and disinfecting frequently touched surfaces. Symptoms are cough, which may produce greenish or yellow, even bloody mucus, fever, sweating and shaking, chills, shortness of breath, rapid, shallow breathing, sharp or stabbing chest pain that gets worse when you breathe deeply or cough, loss of appetite, low energy and fatigue, nausea and vomiting, and confusion, especially in older people. Ways to protect against viruses. So you can wash your hands or sanitize your hands constantly throughout the day, or cough into your arms, or known as the vampire cough.